Hello and welcome to the Body Firm by Jazzy rollback time. And we're trying to roll back time because we're all getting older now. And this series was made so that people could start to listen to all the things that I have acquired over the last 30 some years of my career. As you start to get older, things just don't do as well as they did when you're younger. Cars are a perfect example. They just need a little bit more love as they age. And you are a very complex being, so you're going to be able to do this and see the benefits quickly. I try to handle advertisements as I see them. And yesterday I saw something on amino acids, and this is the key to health and longevity, and I will tell you, hormones are everything. However, synthetic hormones are lethal, and unfortunately, there's a lot of media on it, but it's been proven through and through, and we can see bodybuilders from years ago. It's really going to end up wreaking havoc somewhere on your body. Glands do not like hormones that are not natural. So please, please, please be thoughtful before you do anything. There's nothing wrong with growing old. You just have to take care of yourself. There's no catch-up time. Start now. So today I'm going to do unloading the right hip. And in my career, I have found that almost everybody is loaded and dominant on the right hip. Congenital defects or traumatic injuries from your childhood or at any point during your life can change that. But we're going to think on the level of the majority are right hip dominant. Now, if you are a non-believer, you can do a test. And the test would be in front of a door. I'm gonna use this line, and I'm gonna line myself up with this, and then I'm gonna let my body stand onto my right leg and see where my nose goes to. So it's about here. So if you have a piece of tape, put the tape right there. I'm gonna line myself up again. I'm gonna step onto my left leg, and I'm gonna put my nose here. And so I can eyeball it. It was right in the center, and this one's over to the side. So that's showing me that I'm right hip dominant, because when I'm leaning on my right hip, I have better control of my center. Now, it's not 100% proof. There are people who are really great at compensations and adaptations, and even though they're right hip dominant, they have figured these ways out with their upper body so that they don't move that far over to each side. In that case, you can, I use a Coraline to be able to see this with my clients, but you can, if you have a therapist or a trainer, you can actually have them watch you on a treadmill or something like that as you walk, and you will sway more over to the left. But let's just say the majority of you are going to figure out that you have a right hip dominancy. So we're going to go to the back of the hip, right about here. It's right at the crest of the hip. And you're going to start to just feel that crest where that muscle attaches to the hip. There's a muscle that attaches in there to the hip that we're going to try to find. It's part of the deep line called quadratus lumborum. You also have your psoas in there. And we're going to start to just do a massage. Now, this is the best place to do this is in the shower in the morning. It'll really feel good after the warm water heats up that muscle, and you'll have a nice place to start. And then what we're going to do is we're going to pin this. This is a pin and stretch. I'm going to have you hold your finger, your thumb, on that right hip bone, relax the left leg, and I'm going to have you bring your right leg back, hold that finger there, and you're gonna move the rib cage away from the finger so that the finger moves over the top of the hip, coming to the side of the hip. All right, so it's gonna look like this. It's gonna be away. All right, and I'll show it this way. Away. The leg is back behind you. The leg is back here. So the leg is behind, and you're just moving over to the side. You're just moving over to the side. So what we're trying to do is we're hitting the muscle at the top of the hip, and we're moving the body away from that finger, that thumb, and the muscle should drag underneath the thumb. Now, in the shower, you're gonna have your bare hands on your back, and if you do your whole shower part, and then go back there and do some massage after everything is really warmed up, and then do, it's a myofascial drag. Drag that thumb as you move it away. And as you start to do this, you're gonna feel that muscle start to get softer and softer. So that's the first one. The second one is actually the better one. But that's the first one, that'll get you warmed up to it. The second one, you're gonna move the leg forward, the right leg forward, and you're gonna keep that thumb there, and you're gonna rotate and pull the thumb as you rotate naturally. So as this leg moves forward, as the body rotates through the rib cage, it's gonna gently move the thumb around it. These are really small movements. We don't wanna do this. We don't wanna remove the arm and the rib cage. We want the hips to have some flexion, some bentness to them, the knees to have a little bit of bentness to them, and we want to just move the rib cage enough that we're dragging the thumb myofascially along that crest and opening up that rib cage to the hip. So this is going to be a drag. All right, how many times should you do it? You should do it about 3 to 5 times in the shower, and then during the day, just check yourself once or twice, just a couple times, just looking to see how you're doing. Now, you can do a step up and back, or you can just keep the foot up and do 1, 2, 3, and back, and really try to drag that thumb. If you're at work and you're in a small spot, this is a great, after you do your reset and you finish, then go back and do a little massage back there. And this is a great self-help. I have found in my work over the last 27 years working butt next to the table that I load my right leg a lot. And over the years, my hips have really become imbalanced. I see it a lot with people who do a lot of standing work during the day. So definitely, like people who are working in kitchens, people who are climbing up and down ladders, because that's a big ladder muscle, do a little bit of that reset during the day too. The big reset with those exercises are great, and then this is a great way to unload that right hip. Just those 2 self-help myofascial releases will really help tremendously. And so why? Why does the left hip hurt when the right hip is loaded? Everybody comes in and says, Jen, my whole left side hurts. And I was like, well, let's look. And I'm like, well, it's actually on your right side. Well, you mean it's on my right side? It's my left hip that hurts. Well, if you look at the way this is constructed, I'm having you move around this ridge right here, and the musculature that is the deep core is going to be into these vertebrae right here, and then in and down for quadratus lumborum, and then the spinal erectors. There's spinal muscles, there's spinal erectors. So what's that doing? It's going to be hard to do on this guy. It's pulling you that way. right? But not only that, it's rotating you a little this way too. And look at what I'm doing to all these vertebrae. I'm gonna squish those vertebrae with very weak muscle. And then I'm gonna strain all of this muscle on this side, because your body wants to keep you straight. It wants to keep you in a nice straight line because it's protecting you from injury, it's protecting you from being sideways, it's trying to keep you alive. So if your right hip is loaded and you come down like this and then the hip flexor pulls you back, this hip is gonna go under and you're gonna rotate like this. Right now I can feel the strain on that left back from being elongated. And I already told you that quadratus lumborum, which is that muscle in the lower back, last week was a tonic muscle, it's a postural muscle. So if that quadratus lumborum is subject to hyperactivity and you have it in this position, what's it going to start acting like? It's going to start acting because my body weight has my body dynamic has shifted a little, so the outside part of my body now is starting to pick up some postural technique because it's trying to drag me back over there. So this is going to act different than it normally does. It may start to take on the role of something that is trying to do more of a phasic job, a movement job. And not only that, but it's also being loaded incorrectly. I have found in my career that muscles that are phasic, your movement muscles that are have tonic characteristics, they are thick, like a glute or a spinal erector or a trapezius in the middle of the back. Those muscles are going to be the muscles that are creating a lot of people's chronic pain because they're absolutely doing something they're not supposed to be doing. However, with that said, the postural muscles that are weak and have gotten taut and tight and short are more than likely the culprits. So the first place we're going to start is going to be that right hip. And this work is therapeutic correction through fitness, exercise, and then self-help, myofascial. This does not cut out any professionals though. You still should try to find somebody to give you massage work. You still should seek out help with movement technique and symmetry from somebody who's really good. So it doesn't cut anybody out. It's just teaching you all the little things you should do in between your sessions, because there's a lot of stuff I can't get to. I mean, I can self-help I can even go into subscapularis and do my own releases in there, but I can't get to a lot. I can't get well into the front of my neck by myself. I can't get into my deep hips by myself. So there's a lot of places that are very important that you would need somebody to help you with. So those are your two unloading the right hip technique. That's the number one myofascial exercise that I want you to do. So those are your tips for unloading the right hip.